Yeah. Good evening, everybody. I welcome you all to the 6th global webinar in the series of webinars planned and implemented by IDF and IFRA during the last year and a half to influence the national and global discourse to focus on the impact of poverty and hunger on persons with disabilities, which has been a missing link so far. For those who are joining us for the first time today, just a brief about the background. So in the previous webinars, we documented the voices of experts, emphasizing on the impact of multidimensional poverty on persons with disabilities, then calling for policy and data level interventions. These were followed by identifying practices in CBR that present a roadmap for ensuring equality of opportunity and non-discrimination for all persons with disabilities, particularly those experiencing intersectional marginalization due to the impact of poverty, gender, ethnicity, and the extent of persons with disabilities experiencing high restriction in participation and the impact of unpaid care services on their families, leading to further marginalization. Today, we will be zooming into the issues experienced by persons with rare diseases and the practices that support their participation. So today's topic is from policy to practice. We as a collective are motivated to influence the World Health and to transition from institutional-based care to and support to community living with access to quality community-based services. I would like to call Venky to give his introductory note. Venky, over to you.
Greetings of the day. A warm welcome and a huge thanks to all of you for being with us here today. For those of you who have been with us in previous webinars, would know that we showcase good practice of intervention from resource-based communities. However, this webinar will showcase examples of good practice with people with rare diseases across the spectrum. There is so little work being done with people with rare diseases, so much so services and support systems have not reached people with rare diseases living in resource-based communities. Perhaps for this very reason, rare disease is also known as orphan disease. Hence, we are here today. We are also here today because the World Health Assembly recent two resolutions, namely the highest attainable standard of health for persons with disabilities and strengthening rehabilitation in health systems, do not recognize people with rare diseases as a distinct group. Rare diseases are often associated with long-term impairment, chronic health problem, and potential disability. However, it is to the credit of the advocacy of the disability movement that there is a UN General Assembly resolution on persons living with a rare disease and their families. World Health Organization is the only UN focal agency on health and therefore needs to be proactive to include rare disease intervention and persons living with rare disease and their family in their strategy and program. Why should WHO act now? Here are some facts. Rare disease affect 1 in 2,000 people, 400 million people worldwide, 6 to 8% of the global population. The exact definition of rare disease varies from country to country due to the small number of people affected by each rare disease. Research and development in treatment is limited, making difficult for patients to receive care. 95% of persons identified having a rare disease do not have access to approved orphan drugs. High cost of identification and care leading to economic impact and to poverty. It takes an average of 4 to 7 years for a patient to get diagnosis before series of misdiagnosis and incorrect treatment. No collaboration among healthcare ecosystem. Negligible specialty diagnostic laboratories and the cost of genetic tests is being high. Untrained doctors and paramedics on rare disease. Given this scenario, we are here to pledge to redouble our efforts to change the situation so that the concern of people with rare diseases become more visible at all levels, leading to inclusion of rare disease intervention in health systems. The visibility of this group is nowhere near the visibility of persons with disabilities. We have a long way to go. May we observe a minute silence in solidarity with those with rare diseases.
Thank you all. Thank you, Venky.